So we have just learned the direct pathway, which is stimulatory, right? Now we are going to learn the indirect pathway, okay? The indirect pathway. So here are the neurons from the cortex coming down to the striatum, and when the action potential, or when they are stimulated by a group of neurons, the action potential will flow again the same way exactly, and they will release the glutamate. Like the glutamate was stimulatory in nature, right? When the glutamate is released here, it will stimulate these neurons. Now, in the direct pathway, the neurons were longer and they ended in the interna, globus pallidus interna, but these neurons will end in the globus pallidus externa. So these neurons, when they're stimulated, they will release, they will be stimulated, action potential will go down by glutamate, right? The action potential will go down and it will inhibit, because they will release a lot of GABA here, and it will inhibit these neurons. And now these neurons, they go down to the subthalamus. Now normally they inhibit, but when these neurons are stimulated from in the striatum, they release GABA, and the GABA leads to inhibition of these neurons. When these neurons are inhibited, the previously inhibited neurons are released of inhibition. Now these neurons will be excited because they are released, and they will fire into globus pallidus interna, and they will release a lot of glutamate here, right? And the glutamate will stimulate the inhibitory neurons, the GABAergic neurons here. And when they are stimulated, the action potential again flows, and there will be a lot of GABA released here. When this GABA is released, what happens? These neurons, they will be inhibited, right? They go to the cortex, but now they don't go, the neurons are still in the cortex, of course, right? But they don't release the glutamate at the cortex. These are stimulatory neurons. So this is your indirect pathway. When the direct pathway stimulates, let's say, these two neurons down here, and these two neurons, when they go down, let's say they come out here, okay, and they will go to the cranial nerves as we learned it, or the spinal nerve to the periphery. In the periphery, they will stimulate agonist muscle. Agonist. Let's imagine they stimulate the agonist. While here are the neurons, and that neurons are not stimulated by the indirect pathway, and these neurons also go to the periphery to stimulate other muscles that are antagonist muscles, okay? Now, the direct pathway, when they stimulate the agonist muscle to perform a task, the indirect pathway will inhibit the antagonist muscle to let the agonist perform and do the task, right? So this is how normally it works. But then again, don't forget, we have substantia nigra. Where are the nigrostriatal fiber going to the striatum, okay? And they release the dopamine. Now here, the dopa, whether it's stimulatory or inhibitory, it depends on the receptor. If the dopa works on D1 receptor, it will stimulate and the action will be stimulatory. But if it's on D2 receptor, it will inhibit and the action will be inhibitory. So here, the dopa, when it's released, when the dopa is released, it's it inhibits here, right? So it means there is D2 receptor on the indirect pathway. On direct pathway, it stimulates, so it means there is D1 receptor. Now, what is the function of the nigrostriatal pathway? What does it do? It helps the direct pathway to kick off, to initiate the movement, right? And in indirect pathway, it helps you to stop that movement. Let's say when this pathway degenerates, okay, when this pathway degenerate, like in some diseases, Parkinson disease, you have problem initiating your movement because the neurons here, they are degenerated, okay? You don't have dopa. So what happens, you the people, the Parkinsonism, when those who has Parkinsonism, they have difficulty initiating the movement, right? And once they start the movement, they have difficulty to stop. So let's say the indirect pathway has the antagonist muscle that helps you to stop. So yeah, this is pretty much about the direct and indirect pathway. Thank you for watching, and bye.